Oh my gosh, this is so fun. Hi, everybody. Welcome, everyone, to our own The Mirror virtual event. My name is Carly. I'm super excited to be here with you. I come to you with over 20 years aesthetic industry experience. And I think I've had all the treatments that we're going to discuss today. I've personally had, and I'm super excited that you guys all get to experience tonight and ask lots of questions. So I think, that's how we're going to start. So this summer is about standing in front of the mirror and owning it. No filters, no apologies. Tonight we're going to dive into treatments and really understand how you can reveal your most confident self. So we're super excited. We have a really incredible lineup. So we're going to go into Sculptra, which is a collagen stimulation, which I personally love. It's something that I definitely have used, and I am a big proponent of it. RF microneedling for skin tightening. We've got MOXI for gentle rejuvenation. That's really for like texture, fine lines. And then of course, Dysport, smoothing out the wrinkles, really natural expression. So super excited about you guys seeing all of that. We're gonna have a live question and answering segment coming up with our expert panel of providers. And we've got clients here that are gonna talk about their own testimonies on what they've used and what they've experienced with the lace. And I think any questions you guys have. So just to explain, on your right-hand side, there's a chat, there's polls, and there's question and answer bubbles on the top. So if they're doing a poll, go under that tab. Question and answer is where you're going to put all your questions for any of the treatments or information that you're looking for as we show you guys some videos. So definitely go into that. Don't put it into the chat. It's the question and answers on the top. And then please stay to the end. We have thousands in prizes that we want you all to win, and it's going to be super exciting. So try to hang on here if you can. And then you're also going to get a $50 gift certificate emailed to you for any treatment at any Alace location across the country. So make sure you look for that in your email. So I think we're ready to go. Let's own every reflection together, and let's get started.
Just got to Alace. My appointment's in a couple minutes.
I'm 71 years old.
We've got some lines and we've got some movement.
Alrighty, we are back at Alace Med Spa this week to get Sculptra done. So after losing a significant amount of weight, I started to notice some hollowness in the center of my face and cheeks, which is completely normal after losing the weight that I did. But I wanted to subtly restore that volume without looking like I had work done. So Aaron and I decided that Sculptra would be the best fit.
Sculptra is a synthetic biostimulator, and we inject it to help a patient build their own natural collagen, which will help with shadows, fine lines and wrinkles, and an all-over glow. Sculptra is mainly indicated for the nasolabial folds and the cheek area. In our early 20s, we start losing collagen naturally. Each year, after you hit the age of 24, you lose 1% of collagen. So in order to restore and replace that collagen, we need to use outside or synthetic materials to stimulate our body to produce more. Once you come in, we numb the skin and discuss the treatment options, have them sign a consent and take photos. We'll go ahead and start injecting. Because the product is mixed with a little bit of lidocaine, it really helps with pain. And then afterwards, it's really important that the patient massage all the areas that were injected with Sculptra 5 times a day for 5 minutes for 5 days. After a series of 2 to 3 treatments, you'll start seeing your results in about 3 or 4 months. That collagen will continue to build until the 1-year mark. After the 1-year mark, I would recommend you retreat the areas to freshen up the Sculptra glow.
Cream to all the areas being treated,
Radio frequency microneedling is one of my favorite treatments at Alace Medical Spa. It naturally boosts collagen and elastin. It helps tighten my sagging neck skin. My favorite part is that you can use the treatment around your eyes to get those fine lines and wrinkles. At 46, I have smaller pores and my skin glows more than it did in my 30s.
What RF microneedling does is it actually goes in with needles and then it heats the skin. And so it's the perfect way to be able to wake up that collagen and elastin to get that tightening effect that we need in our skin. The largest organ in our body is our skin. And about 80% of our skin is created with proteins. In our late 20s, that starts to break down. In our 30s, it goes to 1% breaking down a year. And so that's kind of how our skin starts to break down our collagen and elastin. It's like we're born as this nice, beautiful block of cheese, and as we age, it kind of turns into Swiss cheese. And so we have these little holes, big holes, spaces, and so we are trying to reconnect the areas that have those holes. There's such an array of skin concerns that we can treat with RF microneedling. Main would be the tightening, but we can help with fine lines, wrinkles. We can help with our tone and our texture of our skin. We can do hair restoration. Neck is a huge one. We're seeing a lot of younger patients coming in with what we call tech neck, décolleté, our chest area. We can treat stretch marks, arms. We can treat fat pockets in your bra area. Radiofrequency microneedling, we're in clinic, but 80% of our results are actually being done at home. So we want to make sure you are taking care of your skin, not just in clinic, but you are on a good regimen of amazing medical grade products out of the clinic at home.
Just got to a lace. My appointment's in a couple minutes.
I had my first MOXI Laser treatment, so let's talk about it. For the magic happens, she applied numbing cream to all the areas being treated, which helps minimize any discomfort because during the laser you do feel a warm, prickly sensation. And for those that don't know what MOXI is, it is a gentle, non-ablative laser that targets any early signs of sun damage, uneven tone, and texture on your skin. The treatment itself felt warm with a bit of a tingle. Honestly, it's kind of like you're getting a sunburn in real time. It's just happening so fast, and it was totally manageable, especially with the numbing cream on. Also, MOXI is good for any and all skin types. And overall, the treatment went great, but nothing felt better than the mask we put on right afterwards. After the mask, my skin feels cooled down, but I still have that sunburn sensation, which is going to happen a little bit more over time in the next couple hours. Overall, the treatment went fantastic, and I can't wait to see how my results look 1 week after, so stay tuned.
MOXI is a non-ablative laser. The word non-ablative, that just simply means that we aren't taking off any of the skin. Think of it more like actually penetrating deep down into the tissue to target the cells that are damaged and to promote collagen production. MOXI is great for texture, fine lines. It's a really good way to just brighten the skin. Oftentimes we end up coupling BBL and MOXI in the same treatment session. They're really a powerhouse when used together. That's because the BBL, think of it being a little bit more specific. You're taking a certain brown spot or hyperpigmented spot, it is going to target that pigment and break it up. Think of the MOXI more as you're treating that entire surface area, more like working on the whole canvas. Usually afterward, you're a little bit sunburned, you have a light pink tone to the skin. That's going to last anywhere from 24 to 48 hours. As far as the long term, you will have a light sandpaper texture on the skin for about 10 days after the treatment, and then you'll find that they shed off gradually. We tell patients not to scrub them, no exfoliation, no sun exposure, nothing like that. Just let everything heal on its own, and typically that process takes about 10 days.
Just got to a lace. My appointment's in a couple minutes.
I'm 71 years old.
We've got some lines and we've got some movement, and we also got an appointment at a lace. I'm back at my go-to med spa to see the one and only Emily, my injector of 6+ years and the absolute queen of natural results. Of course, we did my usual Dysport refresh. I do a light touch in my forehead, my 11s, and my crow's feet. This helps soften any expression lines while still letting my face move and feel like me.
Dysport is a fast-acting injectable treatment that softens expression lines with a quick appointment and little to no downtime. A lot of people love Dysport because it tends to kick in quicker, just 2-3 days, and will typically last around 3 to 4 months. Dysport is definitely a fan favorite for clients who want something that works fast and looks really natural. Maximize your results with professional post-care. Remember, every skin is unique. Always consult with your lace provider about which post-care products will give you the best results from your treatments.
Hi, well, welcome back, everybody. I hope you guys enjoyed all that really great information. To be honest, I love it all so much. It gets me so excited every time I see it. Truth be told, I'm really 80 years old and I do all of this stuff. So if you do it, then, it'll work. We are going to go into our question and answer segment, which is super exciting because we've got some amazing expert providers here on this panel. And then we also have some real clients that have had all of these done and that they can give you kind of their side of it as well. So I'm going to introduce our panel real quick. If you girls can just give me a little wave when I say your name. So we're going to start with Angie McKnight. This is like Hollywood Squares. Where are you? Oh, you're right there. There you are. Board certified physician assistant with 20 years of injecting experience, specializing in Sculptra, my favorite. She's a Galderma national trainer who teaches physicians and nurses across the country. So welcome, Angie.
Hi.
We've got Heidi Hall. There she is on the top in the center. Master esthetician with over 13 years experience in advanced skincare technology. She's our expert in RF microneedling, MOXI, and laser treatments. Jessie Eisenberg, where are you? There you are. Aesthetic nurse with an MSN and one of our lead injectors. She's known for her artistic approach to Dysport and training the next generation of injectors. So thank you, all three of you, for being here to answer a lot of these really great questions. We've got our amazing client ambassadors. We've got Rachel Todd Bing, former Miss United States and wellness entrepreneur. She's a mama of almost 4 and the creator of the WAVE method. So welcome, Rachel. Thank you for being here. And we've got Steph Murphy, Miss USA Top 10 finalist and CBS Amazing Race competitor. That's super cool. She's also a professional makeup artist and salon owner living the Florida beach life. So welcome everybody here. Well, hello. I don't know who you are, but you're so cute. You don't need any services. We're super excited you guys are here. If you have any questions after those videos, please pop them again in that question and answer box so that we can get to all of them. So I think we're ready. I'm already seeing some questions. Are you ladies ready?
Yep. You're ready.
Awesome. Okay, let's get started. The first question, let's see. I think they're going to pop it up on screen for us. Can you do microneedling if you have rosacea? This might be a good question for you, Heidi. Would you like to answer this one?
Yes, you can. Absolutely. It depends, though, on the severity of the rosacea you have. So there are kinds of rosacea that has more of an acne look, things like that you need to be more cautious with. But you absolutely can do microneedling, RF microneedling with rosacea. When you get this experienced technician, they will know how to do it correctly and safely for rosacea clients. So absolutely you can do it.
Awesome. Thank you very much.
Sorry, I'll hurry to answer this too. RF microneedling, there are specific RF microneedling machines that we have at Elace that actually will help the redness in your skin specifically. So it's a great one for that, along with MOXI too.
Perfect. Thank you. Is 44 too late to start Sculptra? Well, I'm going to let Angie talk all about that, but no.
No way. I'm 45 and I just had Sculptra on Monday. So
44 is the perfect age. I think sometimes we're just now starting to see a little bit of laxity. And when you volumize with Sculptra by stimulating production of collagen and elastin, you're going to lift that little bit of laxity that you have and then help with smile lines by thickening the dermis and just replacing that volume loss. It's the perfect time to start Sculptra.
I 100% agree. And thank you very much. All right, let's go. Delay in a question. Let's see. I can start asking about Amazing Race if we want to. I'm just sorry. We're just waiting for the next question. I think it's about to come up on screen. Let's see. What treatment do you suggest for acne scarring? Again, I don't know if Jesse, you want to take this one, or Heidi?
I'm happy to do some of it, and can too, or vice versa. Whichever.
Okay, go ahead.
I think Heidi on this one.
Okay, so yes, acne scarring is one that no matter if you're younger or older, we can still have that. A lot of acne scarring is post-inflammatory erythema for lighter Fitzpatrick, lighter colored skin, or post-inflammatory pigmentation for a darker colored skin. And so we need to address what that issue is for that specific skin color. RF microneedling can start to break that up. As far as a scar that's actually indented into the skin, you're going to see a lot more results with RF microneedling than any other modality, I believe, that we have right now, because we can go deeper. It's like just regular microneedling on steroids. And so we can go deeper, ignite that collagen elastin in those specific areas more to help build that back up. And so RF microneedling, hands down, I will pick every time for acne scarring.
That's awesome. Thank you, Heidi. Anybody have anything to add, or do you want to move on? No? Okay. What's the best treatment for loose skin on the body after weight loss? This is a pretty good one. Maybe Angie, you should maybe address this one.
So I love Fotona laser. It's a Neridium YAG and Erbium YAG laser that you can do on the face, neck, and any body area. It works by bulk heating the area to elicit collagen production. You'll see some results, at a month later, but the results continue to improve up to 6 months after the treatment. But you can do treatments like every 4 to 6 weeks. We recommend 4 treatments, and then wait to see your final results 6 months after the last treatment. Typically, the area just looks a little red after the treatment, and there can be some dryness and peeling for anywhere from 5 days to 2 weeks, depending on what body area. If it's the face, you could be healed from the treatment in 5 days. On the body, it could take up to 2 weeks just because of the last step, which is the resurfacing, the actual heating up of the skin to stimulate collagen. You could do that and not even be red an hour later. But the resurfacing, which we can actually do fractionated or ablative, would determine how long the healing process is. So you could have no downtime from that laser and still get a lot of collagen production and skin tightening. So I love it so much. It's super impressive.
I haven't had that one, so I'd like to have that, please, next. Thank you very much.
And that really would be dependent on the area that you are as far as location for Elace. Not all Elaces carry that.
Yeah. And there's some, I think Sculptra can also address a little bit of that as well. I think maybe not for, a lot of weight loss, but I know, and I've personally had it above my knees for the sagging of the knees, sometimes in the décolleté. Is that correct?
And RF microneedling can also do that, help with tightening and igniting that collagen elastin too.
Perfect. So we've got everything honestly, to treat you.
Yep.
You can, like you just said, you can inject Sculptra too. So all those treatments can be, done at different times to help with the collagen production because it's a process. So
yeah.
And one of the things too that I've always said too, that they obviously work really well together, right? So kind of sandwiching those treatments, if you are doing Sculptra, maybe like 3 to 4 weeks post that, then kind of hitting that with that radio frequency with microneedling. It's kind of like the fertilizer and then coming with the water on top. So they complement each other really well.
Wonderful. Lots of great options. We have a question coming in from Kristen. I've always taken care of my face and my neck, but my neck looks so much older. Yeah, that happens. What services do you suggest? Who would like to take this one?
I mean, I can kind of start. I think that the neck is one of the most challenging areas, especially from an injector perspective. You know, you have the elasticity, texture, but there are a lot of things that we can do to kind of help improve those areas. Definitely, as we were kind of mentioning, Carly was saying, Sculptra, you know, stimulating collagen and elastin in that area. Also doing radio frequency with microneedling. I always recommend, at least to my patients, that, you know, when you are doing services for the face, including the neck and adding that on, because that is obviously going to continue to age at the same time. But I'm sure Heidi can kind of go in a little bit more detail with that.
Yeah, what she was saying exactly. I think multimodalities are the best way to do it. Especially, we forget when we were younger. I'm in my mid 50s, so we forget when we're younger to treat our neck. We treat our face and then we stop at our jawline a lot of times and don't realize how critical and important our neck is along with it, and it ages almost 5 times faster than our face. So, and then think of like how we're leaning down and look at the phone since our children, since they were 2. And so that heaviness of this heavy head laying down are causing these really deep necklines in younger also clients. But between injectables, RF microneedling, and even MOXI for more surface, and MOXI, RF microneedling with MOXI would be amazing, because then you go in deeper and then you go into those more superficial fine lines and wrinkles. And that's an amazing combination modality that you could do in the same treatment. That would be amazing for both face and neck.
Yeah, that's a great thing. And Steph and Rachel, have you guys had some of these options on your neck as well when you're treating your face?
I can attest to MOXI for sure.
Yeah.
Doing the MOXI, but I want to do Sculptra on my neck now that we've said it, because I've done it on my face, and I Sculptra. I don't think I've ever spoken more highly of anything, and I'm almost 38, and I have acne scars, and I love the sun, sadly. So I don't know. I've done everything, but I've never done MOXI on my neck. And I've never done Sculptra on my neck. So now I want to do both.
Yes.
And I would say to add it for the back of your hands too, MOXI and RF. Yeah, okay. It's a good one.
I'm your stereotypical redhead with freckles, and now at 38, getting age spots and seeing uneven pigmentation. And I've never had better results than after BBL MOXI combined for my type of skin. I fortunately don't deal with, I didn't deal with any skin issues growing up because I have such dry Irish skin. So I don't have an overproduction of oil, which is great. I'm now dealing with all of the age stuff coming up from feeling like I was eventually going to get tan if I laid out in the sun long enough as a teenager. So those of you watching that might be under the age of 20 and you have red hair and freckles, you're not going to get tan. Please stay in the shade. Big giant hat and just embrace it. But I've really, really loved my results with BBL and MOXI. Same with Steph, my Sculptra treatments. I don't know if I've ever felt more like a supermodel than having Sculptra. The results were almost immediate, it felt like, but they just kept getting better and better, like exponentially better over time. And I have loved also RF microneedling. So all of it.
That's awesome. Thank you very much. I appreciate that. All right, let's see. What's up? Ooh, okay. Dysport versus Botox. Does one last longer than another? Jessie, why don't you take this one and give us your thoughts?
It's a very common question. And at the end of the day, all of these products are botulinum toxin type A. What makes them different, it's kind of like the Kleenex brand. I think we're often all guilty of referring to everything as Botox, 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 right? But there's different brands out there. As they're all neuromodulators and all botulinum toxin type A, that difference in the accessory protein between Botox and Dysport is obviously what makes them a little bit different. In terms of how long one lasts over the other, everyone kind of knows that I would drink Dysport for breakfast. It is my favorite product that is out there. I love that it does kick in a little bit earlier, as we kind of learned from the video that we saw. So in terms of one lasting longer than the other, I often find for my patients, both Botox and Dysport are indicated to last up to 3, possibly 4 months. Obviously, a lot of factors go into that, how quickly you metabolize a product, also a patient's aesthetic. If some patients like to have a little bit of that natural movement, right, it might come back a little bit earlier than that. But for me personally, I have found that my patients have been able to kind of push it a little bit longer once we find their little cocktail recipe that works for them. But in the same breath, because it kicks in a little bit earlier, it's nice. You can get, the results a little bit earlier.
Is it kind of like switching your shampoos? Like you need to switch your shampoos, like going back and forth, because your body gets used to it?
Totally. I mean, I think it's
I've
good
always
to
wondered that.
Definitely, like every once in a while. I think too, in the same breath, if something really works well for you, it is kind of nice to stick with that. But in terms of resistancy, right? That's a very common question that I get asked a lot. And I always say it's probably easier to get an antibiotic from a doctor. It's hard to get those things. So in terms of resistancy, it's not the frequency, it's the frequency with which you do it. It's not the amount of units that you do at a time. So with switching up products, it does limit your chance of resistancy, but it's not necessarily something that you have to do, if that makes sense.
Yeah, totally.
I think consistency too is huge. When you get a little older and you push it and you push it, those resting wrinkles where when you're showing no emotion, you can still see them, they'll start to creep back up. And then they're harder to get rid of or to soften if you don't stay. So when you're in for your appointment, reschedule for 12, 13 weeks later for your next appointment, and you stay on that, you will be able to control any resting wrinkle to form, meaning the ones that you're laying there and not showing any emotion, it's still there. Those you can take care of. So consistency is huge with injections.
Yeah. And I find too, I tell patients, you want to treat it like a gas tank. You want to get to it before it's completely empty, because once that muscle and tissue have had that opportunity to kind of touch there, you're kind of starting over. So really with each treatment, what we're looking for is that muscle strength is getting less and less with each treatment. So those lines that you have at rest are getting softer and softer.
So we just need it all the time. We need to drink it like Jessie.
Yep, for sure.
I do think the Dysport though consistently lasts a little longer in between the eyes for the frown line. So people that have more issues with that line and it not maybe holding as long. Over the years, I've consistently, like she said, if you're coming in regularly and doing your treatments, some people will go 5 months without even having any frown, without being able to move that area. I don't see that as much with the other areas, but it does seem to last about a month longer than Botox. And obviously everyone's different. It may affect some people differently than others, but it's something that I have observed on most of my patients. So
definitely.
Awesome. Thank you. Okay, we've got a good one here. Best treatment for sunspots on my face, please. This is from Mindy, and maybe I think Heidi should probably attack this one.
So normally it would be BBL. BBL is going to be my number one first choice always for pigment. If you are a darker Fitzpatrick, meaning a Fitzpatrick 5 or 6, darker tan skin, that isn't going to be my favorite treatment. Microneedling with chemical peels, things like that are going to be safer. I always want to make sure we customize it to your skin color. And so safety is our number one concern with that. And BBL with a darker Fitzpatrick is not safe. So a darker skin color. But microneedling on its own, microneedling with a chemical peel is even better. RF microneedling can break it up a tiny bit, still isn't going to be my favorite choice. That's more tightening. So microneedling, chemical peels, or BBL MOXI if you're a lighter coloring.
Amazing. Thank you. Which treatment is clinically shown to stimulate collagen production the most? Who wants to take this one?
Good question. I think it would be Sculptra, honestly, out of all the treatments. I mean, I'm trying to remember the exact statistic, but I think like 63% increase in collagen. You know, you can visibly see. So when you inject Sculptra, not only are you getting volume, but you're actually seeing improvement in the texture and the fine lines and wrinkles. If you, I love, you know, microneedling, the Morpheus, the radio frequency with microneedling, but you're not getting the volume with that you're getting with Sculptra. So think of Sculptra as like filler and laser combined. And, you know, what's better than that? I mean, and the results are so fast. You can see results in as little as a month, where you're starting to see lift to your cheeks in some volume, and like your skin is starting to glow. And when you smile, you have a little bit less wrinkling. And I think it actually even helps your Dysport treatments to work better. So sometimes I'll be treating someone with crow's feet, and you know, they're not completely getting rid of those lines when they smile because maybe the lines go down their cheek a little further. If you inject Sculptra into that area, when you replace the volume and you thicken the dermis by stimulating collagen and elastin, you get volume and you get improvement of those lines in a very short period of time. So someone could come back 2 months after having 2 vials of Sculptra and see significant difference with one treatment.
And then with RF microneedling, you could do that 30, 60 days later to kind of finesse and finish off any of that at a deeper level too. So there's that amazing combination of choices. I wouldn't do them at the same time at all. You need to wait at least 30 days post any kind of injection like that. But if you want to really tighten up those more surface, that would be a great combination to do.
Yeah, and I think too, like when you think about it, you know, we're injecting Sculptra into the deep dermis, like where the fibroblasts produce the collagen. So we're going straight to the source. And so it takes your body really about 6 to 8 weeks to produce collagen. And that's why a lot of the times with Sculptra, right, we see with each decade of life, your ability to produce collagen drastically decreases. So, you know, a good kind of general term, right, is like someone in their 30s needs about 3 vials, someone in their 40s needs about 4. And then coming with the radio frequency with the microneedling to give it that little supercharge, because you can do as many injectables as you want. And I always say this, but it's really that canvas and that skin, it's everything. So it really just kind of heightens and takes the Sculptra to the next level.
You know, it's interesting just listening to you guys. I think ultimately coming into a lace and getting a consultation is really the best avenue to start, right? Because we all have different skin types, textures, different issues that we're working with. And I would say probably Steph and Rachel, you both have probably come in and had a consultation. And I'd love to hear you speak to that a little bit, because I think sometimes we think we know best, right? Well, we always know best. But really we don't, and we don't know what we're talking about half the time when it comes to all of these, because there's so many different things out there. So I'd love to hear from both of you to just talk a little bit about consultation process that maybe you've gone through at a lace.
Rach, go ahead. I'll let you go first.
I actually really think it's important to do consultations almost seasonally, because your skin is changing. And so it's almost like you need to reassess as you're going along and see how things are progressing, this treatment, that treatment, and take a look at your skin with the provider in the room with you, with the lights up nice and bright in the mirror, so that you guys can talk about it together. Because you can sit in front of, and yes, we are owning the mirror, no filters, all the things, but we do sit in front of the mirror in our own bathrooms and come up with all these ideas of, I need this and I need that, and this is what's going to fix that. And it's not till you're sitting with a provider who can, as you guys have heard them speak tonight, really talk about what's going to be best for your skin and the results that you're wanting, because everybody has different results that they're wanting from their treatments, and it looks completely different for everybody. So a consult is so important, and I guess I would call them like maintenance consults is what I really enjoy. And so whenever I make an appointment, not every time, but I do ask every once in a while for them to work in some extra time with the provider. And I take notes, and I have a plan, and I have a game plan going with them. And I'm currently pregnant, so that game plan got shifted a little bit. And I even asked, like, are you guys sure there's nothing else we can do right now during this time? So we're excited for December. And I did see that question on the, I'm sure it's not going to get probably put up because not everybody's pregnant right now, but there are lots of things that you can do to maintain good skin while you're waiting through your pregnancy. And then after pregnancy, there's lots of things you can do, even while breastfeeding, if you're pumping and can wait 24 hours before you're giving that to the baby, that type of thing. I'm happy to address that on the side with whoever is pregnant or going to be breastfeeding in the next few months or so. But talk to a provider because there's lots of things you can do even while pregnant to maintain beautiful glowing skin, including some awesome skincare products. And then just be excited for what you're getting ready to experience once you have the baby, because then you're going to be ready for your postpartum glow season.
Well, and your time then. You did the hard work. Now it's a little of your time.
Correct.
Well, congratulations. That's amazing. Steph, what about you?
Just piggybacking off what she said, I think just like being a hairstylist, it's so important to have goals, you know, and I think another important thing to realize and own is that we are women. So our minds change all the time, you know, so we may get something and we get to a certain point and they were like, oh, okay. I think I have a new idea now, you know, and I'm saying that because I'm about to turn 38. So it's like, okay, what do I really want? Because my first consultation was, I looked at my provider and I knew that she was at least 15 years older than me. And she had no pores. And I looked at her face and I said, I want your skin. So whatever goal I had just changed because I walked into the room and she had no makeup on and she was beaming. And I grew up, unfortunately, I was a swimmer my whole life. So I was drowning in chlorine basically. And I had really bad acne and I still have acne scars. Well, not as much anymore. But I've always had a journey. I've always had a challenge ahead of me. So that's why, honestly, what catapulted me to become a makeup artist, because I needed a tool to cover up like my shame, my acne shame. So I'm always like encouraging people. You know, I think it's hard. We think it's like what we can eat, what we can put in our body, but that's not all that skin is. It is so much more than that. And it does start young. I mean, even you just going to the point of your neck. I'm so lucky I grew up with a mom that's actually looks more like Rachel, ginger, you know, beautiful, pale skin. So then she has a daughter like me and she's like, protect your skin, protect it. And exfoliate for the love of God. So, you know, I grew up in a house where my mom was a hairstylist too, and it helped, but it didn't take till I was like probably 28 to realize, oh man, I've done a lot of damage and I need to reassess. And after every child, I was like, I wore a different body and different skin again. So it's just restarting over and being really happy with like, oh, like, look at how far I've come. Like my pores have shrunk and now I have, you know, glowier skin. What's my next goal for my next season of life? Really?
Well, thank you. I think this is a good question to lead into that. The best treatment for just prevention and help with overall skin health. Heidi, you probably have really good tips on what preventative skincare would be.
So that would be obvious. So 80% of our results are from what we do at home. So it's critical that we're using medical grade skincare daily. Consistency is the key. So no matter if you're home at 3 a.m., you do your double wash and you do your things. That's critical. But MOXI is an amazing one for prevention. It's great for what we call pre-rejuvenation. So when you are in that goal time of trying to prevent, MOXI is more superficial. And so you're going to treat all of the little naughty things that come out, the pigment, the reds, the tiny little fine lines and wrinkles with MOXI. So it's a great, amazing treatment. Absolute favorite for pre-rejuvenation. Also for men, just a heads up. If you have your hubby or partner or whoever that says, you know what, I'm looking, or they're looking at you like, what are you doing? Because you look very different than I do. I look 90 years older. But it's a great one for men because it's safe for hair follicles for men. So MOXI is an amazing treatment for men too. So get your guys in here too.
That's amazing. Thank you. I think we have time for one more question and then we're going to wrap this section up. Although I think we could probably talk for hours and There's
Totally.
so much good information you guys are providing. So thank you so much. Okay, so the last question we have, let's see what that's going to be, comes from Allie. Best treatment for nasolabial folds. Okay, girls, let's see. Angie or Jesse, you want to address those?
Yeah, I mean, there's two options, but I mean, the easiest and quickest results will be with a dermal filler like Restylane, that's made up of hyaluronic acid. So it's a filler that you can just instantly see results and just fill the nasolabial folds. We can also put Sculptra there. So I do Sculptra there more than I ever have. In the past, I may have been more likely to use a filler, but I put Sculptra in the nasolabial folds, right in the corners of the nose, also all the time. And I have the approach now that I would rather stimulate production of collagen and improve the skin than just filling with a filler. So unless a person's wanting just instant results, I do Sculptra there now. So
Yeah, and I think for me, one of the things that like having nasolabial folds, it's a good thing. You want to have a little bit of a nasolabial fold. Otherwise, to me, it doesn't look natural, right? I think too, one of the things when you hear about supporting that nasolabial fold area, right? As we age, this anterior medial deep fat compartment, it's one of the first fat compartments that do tend to kind of shrink down there. So really, I always say we want to make sure we're supporting that area. And then obviously depending on the patient, and that's why consultation is so key, because we do have all these different amazing tools that we can utilize to support that area. And then obviously if that nasolabial fold does need a little bit of support, kind of using it almost filler like an icing, right? If we're not using something like Sculptra to stimulate collagen.
That's awesome. Yeah. Great.
I totally agree with that. If you fix the volume loss in the cheeks, frequently you don't even need any filler or Sculptra in the nasolabial fold. So just lifting the cheeks addresses the line there. So.
And when you guys talked about changes earlier, remember years ago, they would fill here. We would have fillers and all these things. So we just kind of became bigger, less feminine looking, things like that. They have found through the years, you're filling up, we're doing Sculptra and we're pulling here. And all of a sudden those nasolabias soften enough that you don't need anything more there. Yep. So there's so many more beautiful ways to have a different look and more feminine look, which is all of our kind of goals, I would think, to pull those nasolabias up.
Yeah, and one of the areas too that I really think is kind of like underutilized, or like the temples, right? I would say the temples are kind of like the furnace of your house. No one's going to come in and be like, hi, like I need temple filler. But again, this lateral temporal fat pad, another one that really does age very quickly. And we know if we work more laterally, right, that's going to give us support and affect that tissue that is a little bit lower.
Amazing. Thanks, ladies. This has been so informational. I know everyone is going to go and do all the things. I'm employing you to do all the things. You guys, remember, are all getting the $50 toward any treatment at any of the Lace locations. So you just go ahead and start booking that right away. But I want to thank everybody on this panel. You guys are so smart. Thank you so much for all of the expert providers and our beautiful, beautiful clients. Thank you for telling your stories and being involved in this tonight. It's incredible. And I'm sure everybody is very thankful for all your amazing advice. So I think that we are going to, kind of wrap things up and head toward our big prizes, which are really great. So I'm not sure what is next, but I think, maybe it's just me staying on by. My Hollywood Square girls are all leaving me one by one. I'll be all by myself. Yeah, so I think what we're going to do is go right into our prize segment, our last and final. You guys, we've had prizes all throughout, and they're definitely going to pin the winners. They're also going to follow up with emails for all the winners tonight, okay? So let's see. The winner from the two giveaways earlier were Tracy Chestnut and Grace Roth. So congratulations, yay. If I could have confetti come on, I would. Sometimes it happens, but not tonight, I guess. But that's amazing. Congratulations. And I think we've got, yes. So this one, Skin Better Skincare Basket, try to say that 10 times, and Daily Bundle, a $1,200 value is our first big giveaway. So I hope you all win, but only one of you can, sorry. I guess drum roll, please. Do we not have any effects? Is it just me? Here we go. Oh, the winner is Amanda. I don't know how to say your name. Florini? I think that's it. Amanda Florini. So congratulations. That's an amazing basket. I'm really jealous. So congratulations again. You're going to get an email with that information. The second one is the Nectar Elastin Bundle Skincare Basket. Again, this is going to be a drum roll, and we're going to have a winner. I think I sound really dumb. The winner is Fashila. Oh, I don't know how to say this either. Sorry. I don't know. Sorry. You can see it on the bottom. I don't want to butcher your name, but I'm so excited for you. And I love Elastin, so I think you're going to love it too. And then we've got a really big one. This is a year supply or a year free Dysport, 300 units. It's amazing. It's one of my very favorite products. And the big winner of this one is, I'll change it up. Who's it going to be? Ooh, Haley Vinek. I'm saying that wrong too. I'm so sorry. Again, congratulations to all the winners tonight. All of you will get an email to tell you exactly how to claim your prize. And again, please, please, please look into your email for your $50 gift card toward treatment. I am going to tell you guys how to book. And if it were me, I would go ahead and book now, because this does expire. Those gift cards expire on August 31st. You have two ways. We're going to text you and you can reply yes, and then that will help prompt to how to book, or you can do the QR code here. You can also go to our website at alace.com and you can get yourself all booked into the nearest location that you're in. So definitely do that. I would do it now. I'm all about getting things done, but if not, please get that done before August 31st is when the deadline is. But for everybody for joining us tonight, we so appreciate your time. Loved all the questions. You guys did amazing. Our panel did amazing by answering everything. And I hope that you guys have a wonderful night. I hope that you own the mirror and just know how special you are. So thank you guys so much for joining us. Good night.